Hi, my name is Maya Thurmond, and my pronouns are she, her, and my project focus is the disproportionately high rates of pregnancy-related deaths among Black women. So this is a very important issue because often these are healthy Black women that are dying at 2 to 3 times the rate of their healthy white counterparts. There are many contributing factors, but the 3 main ones are implicit bias these women face when they try to receive care, lack of access to healthcare, and generational stress. My target population for this project are Black women in Stewart County, Georgia. I chose Georgia because the rate at which Black women in Georgia die from pregnancy-related causes is almost 6 times that of the national average for white women. Stewart County also has a largely Black population and currently has 0 practicing OBGYNs within the county. My solution would be a clinic that offers many services to the women and their families, including support groups before and after the children are born, educational classes, as well as free transportation if needed. I also wanted this to be as accessible as possible, so whatever the family's financial need is, it can be met. I also wanted the solution to be current, so anything that can be offered virtually will be. This includes some checkups, all support groups, as well as all educational classes. The staff will also be mostly people of color to ensure the family's safety as well as comfort. This will be possible by partnering with medical universities currently in Georgia who offer incentives to med students who commit to serving an underserved population in Georgia. The most important part of this clinic to me is that Black women and their families are given priority, but this clinic is open to all parents and families. This clinic will not only make it possible for many women to have an almost completely positive experience when having a baby, it will also save the lives of Black mothers and their children. Thank you.
Hi, so my name is Devin Dinh, and I go by he, him pronouns. And then over the summer, I worked to find a solution towards food deserts and food insecurity, specifically in low-income minority communities such as Richmond and West Oakland. Food deserts are majority caused by factors of redlining, where roughly 70% of Richmond's residents are of Black and brown minority backgrounds. And that food deserts contribute to health issues where 50% of youth and 58% of adults are overweight or obese, as reported by the UC Berkeley Haas Institute and Contra Costa Health Services. This shows that wealth inequality and lack of access to quality services is prevalent, based on this data alone. I plan to address this issue of food deserts and food insecurity to strengthen these communities by working with youth, as they are the next changing agent where they will be the educators of the next generation, in order to inform their peers and the adults in their lives about this large, wide issue, as well as bringing tax incentives to creating a grocery co-op with a community center aspect to it, which will be helpful where it will allow residents to get access to healthy and fresh food options, bringing in localized farming initiatives and adding services that will greatly benefit the community, such as a walk-in health clinic and a credit union cash checking services.
Hi everyone, my name is Neha Prasad and my pronouns are she and her. My project is called Creating Classroom Connections, and the focus issue is the lack of educational resources for students with mental disabilities and how it negatively impacts their mental health. In 1975, the Individuals with Disabilities Act established that 40% of a school's excess cost should be put towards resources for students with mental disabilities, but on average, only 15% of a school's excess cost is actually used. This has led to a 17% decrease in teachers for these students, and the teachers that are available are often not properly trained or informed about the challenges that students with mental disabilities face both academically and socially. This has also led to a 31% increase in dropout rates for students with mental disabilities. My solution is to create summer classes similar to seminars that teachers attend where they learn about new curriculum that is being implemented, where new teachers will learn and have experience on what it's like to work with students with mental disabilities. These new teachers will be trained by current IEP teachers. Those are teachers that teach students who are on individual education plans and modified grading systems due to their disabilities. These new teachers will be established as their main teachers for all 4 years of their high school years and will be set a group of students based on how similar their IEPs are. The goal of this solution is to create a positive learning environment for these students where they feel comfortable and motivated to succeed. To ensure that the students' voices and needs are heard, we will have students with mental disabilities attend these classes so that upcoming teachers get firsthand experience with working with them and creating personal connections with them. And to ensure that their voices are heard, we will have a representative for them on the Parent-Teacher-Student Association, so the school board and families of these students are actively updated on their needs and progress throughout the school years. Hopefully, if this solution is beneficial, their graduation rates will increase and they will get into colleges and gain good jobs and positively contribute to society. If the school also sees how beneficial this is, they'll also consider putting more funding towards these students to make up for the lack of finance that they've received throughout the years. Thank you.
Hi everyone, my name is Patience Okani. My pronouns are she and her, and my presentation is called Helping Atlanta Rise Again, which focuses on the racial disparities in the city of Atlanta, Georgia. Atlanta, as we know it today, is one of the most developed and biggest cities in the South. Although the population of Atlanta is approximately 51% Black, Atlanta still sees major racial disparities in healthcare practices. The city saw the widest gap in breast cancer mortality rates in America, with 44 out of 100,000 Black women dying, compared to 20 out of 100,000 Caucasian women dying in 2016. There is also a 12-year or more difference in lifespan in the people living in predominantly Black neighborhoods compared to other neighborhoods. The history of Black citizens in Atlanta being pushed aside can be traced back to when slavery was legal. Myths about the pain tolerance of the enslaved being higher than others were pushed into medical journals and textbooks we still see today. One being the Southern Medical and Surgical Journal, which was created in a city about 2 hours away from Atlanta. Because of this, Black Atlantans are not being considered for treatment by their doctors and dying at higher rates than their counterparts. My solution for this problem is to change the medical school curriculum for future medical providers studying or hoping to study in Atlanta. At the moment, both the Emory and Morehouse Schools of Medicine in Atlanta have programs to go out and work with ethnic minority groups in Atlanta hospitals. Although this is a great thing, these programs are only for medical students who are in their 3rd and 4th year. My solution is different, as it asks for funding to be placed in programs that will primarily be in students' first 2 years of medical school, which is a vital part of their journey into becoming a physician, as that is when they learn fundamentals that will be placed into clinical participation and residency. This means that introducing new classes that teach about the history of Black/African Americans in America and their relationship with healthcare, or making sure that students know what certain diseases look like in the Black population. My solution will provide a way for those distrusting of the system to be accepted into their arms without any prejudices blocking them. The city of Atlanta's motto can be translated to rising again from Latin, but as long as Black Atlantans are being disregarded at the hands of the healthcare system and medical schools in Atlanta are not combating the effects of harmful curriculum, the city will truly never rise again.
Hi, my name is Marcen Garcia. My pronouns are she, her. The title of my presentation is Mental Wellness and Introspect. The issue I will be discussing is access to mental health services in high schools in the West Contra Costa Unified School District. Do you know how many students experience mental health challenges that influence their lifestyle? 1 in 10 youth face obstacles that damage their home, school, and community life. 80% are deprived from obtaining necessary mental health services. In high school populations nationwide, more than half of the dropouts have emotional and behavioral disabilities. Students have decreased performances in school activities such as classwork, involvement, and productivity. Schools are also limited in programs that will help students mentally and emotionally due to the demand and in funding for other programs such as sports and clubs. Mental health services such as counselors and health centers are inadequate in fulfilling students' emotional needs. Having those services available makes the district or school satisfied, but they fail to address the student dissatisfaction. Mandatory district-wide staff training in youth mental health can help provide students with the support they need. Training includes a program where they learn about emotional and behavioral disabilities in students and how to best support their students when they encounter situations. Staff can then use their knowledge to implement a safe, comfortable environment for students to discuss mental health challenges with those around them. Throughout the year, teachers understand students as individuals, their struggles, successes, habits, and behavior. The relationship and communication between teacher and student will already be developing, so it is easier for a comfortable space to form between them. For mental health services provided by staff, there will be a student to staff panel to reflect on experiences, then make recommendations and improvements to do better in supporting both groups. Through mental wellness and introspection, high school students will thrive in an environment that promotes student involvement and educational support to set them on their path for college and future careers. Thank you.
Hello, my name is Aguilar Martinez, and I go by he, him pronouns. And the title of my project is called Lost in Translation. And the topic of issue that I have chosen to focus on is the lack of interpreters in the healthcare system. So currently, there are over 150,000 people who speak less than well English in the Contra Costa County, which is a bigger population than any city in Contra Costa, making it a very important issue to address. Currently, the biggest group is the Latinx community, which makes up 81,467 of the previously mentioned 150,000 people who speak less than well English in the county. Another fact is that according to a study done by Glenn Flores, a director of health service research, they found that by not having any interpreters in healthcare, the service provided would result in the quality of care being compromised, and that by having interpreters who aren't trained well would result in a quality of care that is inferior and with more interpreter errors. The inequity in this issue is the fact that minorities have to compromise. It is unfair that people feel uncomfortable or feel like they're not being understood well enough when it comes to a topic as serious as their health. It is also unfair that a huge part of the community has to struggle to communicate or has to get subpar assistance. So this is an issue that could be prevented and has been tried to been resolved in the past, but based on my experience and the experience of others, it's one that has yet to be solved. So my solution would be to implement a policy that would make it a requirement to have a certain number of interpreters on staff that are trained and certified to be able to translate anything from front desk questions to things from specialized fields. The way to determine how many interpreters should be on staff would be based on the amount of floors or services a facility provides. I would also suggest the biggest languages having translators to start. So, for example, that would be Spanish, Mandarin, and Arabic, and later adding more based on how well the policy impacts the county healthcare system. So, by having actual staff rather than a service, it would make a patient feel more comfortable and feel less stressed out about having communication be an issue, so they can just focus on the topic on hand, which is going to a hospital or clinic to have their health checked or to go get help. I believe that the county healthcare system would benefit from having proper interpreters because they would see an uptick in the quality of health bigger than the size of any city in the county, which would help many generations to come. Thank you.
My name's Lara, and my title is called On the Streets. It's a public safety system for the Bay Area community. It's to handle situations like mental health, homelessness, abuse, suicide, and safety. It's for the safety without the necessary danger of anxiety that police officers working alone can bring. The Bay Area has the third largest population experiencing with homelessness, about 28,000 people in the US. People who are homeless or suffering from mental health challenges can often end up with unnecessary arrests or shootings by the police. 911 operators often get calls to deal with unwanted people, That could mean from homeless people setting up camps to someone acting strangely. According to the Washington Post database, anywhere from 62% to 90% will be arrested. Police often do that because it's just to get them out for the night. They end up in jail and not in treatment. And that's a major problem because the cycle just continues and nothing changes. In my solution, the public safety team will respond to one of these calls by taking a team of an EMT or a nurse paired with a crisis worker experienced in behavioral health. All team members must complete 500 hours of training and will be equipped with a van filled with water, food, medical kits to provide transportation to hospitals and shelters. They handle situations like mental health, homelessness, abuse, suicide, first aid, and non-emergency health medical care. This solution will prevent encounters with police that might not know how to handle the situation properly and won't end up in a shooting, arrest, or an unwanted death. The program is to talk to people and handle their needs in difficult situations. The team will check if they are hurt, and if it's out of the range of medical expertise, they could take a team and take them to the hospital. Or with a person having a mental health or homeless issue, they'll see if they need help or stay or place to stay. They could take them to a shelter to handle the situation. There are just way too many cases with 911 operators sending a police officer to handle a situation that they're not even trained for, especially with care. It is every person's right to live in a community that is dependable, where people who are homeless, suffering from mental issues, with suicide situations can be safe and live their best life with respect. Thank you.
Hi, my name is Itzel Martinez, and the title of my project is Eco Healthcare for Undocumented Immigrants. My project focus is healthcare for undocumented immigrants in California due to them not having healthcare. The Affordable Act Care extended access to health coverage to about 3.3 million people, but not to California's undocumented immigrants. In California, 39% of undocumented individuals lack a source of healthcare. The average number of annual doctor visits by undocumented immigrants are lower, 2.3 for children and 1.7 for adults, compared with 2.8 doctor visits for US-born children and 3.2 for adults. The people being affected are all immigrants from all ages. They are being affected in a way that they only get emergency health care where it puts their life at risk. They could be at risk and not know about it until it is too late, or where they are in a situation where it could affect them in the long run. Another reason they do not seek healthcare is a lack of knowledge and the confusion about rules and regulations, like the fear of them getting deported. Healthcare is funded by taxes such as the federal and state government. Undocumented immigrants contribute in tax revenues that also goes towards the funding of healthcare. In Sacramento County, they estimate that they contribute a total of $29.6 million. My solution would be to set up a program that undocumented immigrants to fund their own healthcare with also the help of funders who are able to help. This would allow them to have complete healthcare benefits due to them funding their own program with their own taxes. This program would benefit for all undocumented immigrants in California. We can ensure that the tax funds are going to be set aside for them by making it a health fund where the IRS and the California Department of Health Care Services would work together. This solution is innovative because they would get healthcare and that would provide them to be healthy and productive. People are aware that they contributed taxes yet receive no complete benefit to healthcare. And this would benefit the community to prosper in a way where they are healthy to work. And my solution works, our people wouldn't have to worry about their health because they would have healthcare. Thank you.
Hello, everyone. This is Kritika, and my issue is dropout rates of children from school in Nepal because of their family's low income. Getting education in Nepal has always been hard since it was historically only provided to wealthy people. So the struggle to get good education has always been there for poor people since the very beginning. More people are getting education in the present time, but the struggle for low-income families stays the same. Um, the enrollment rates for the primary school age children are very high, which is 97%. However, the dropout rates of primary school are also very high, which is 45%, and 1 in 3 won't ever enroll in school. A big reason for school dropout is that the families want their children to work to provide money for the family instead of going to school. Families living in poverty think that working is more important than getting education. My upstream solution for this issue is that I will organize a workshop in the rural areas for the parents where I will invite guest speakers to give them awareness about the importance of education. I will choose the speakers from different backgrounds in Nepal who went through similar struggles to get education. The speakers will give speeches about how important education is and how it changed not only their lives but also the lives of people around them. And they will also talk about the things they did to overcome the struggles. If the solution works, then for the future, I will organize a group for people all over the world where they could come to Nepal and give education to the children. I will be organizing this for the international teachers and volunteers because in Nepal, teaching is not really considered a good job since it does not really pay well unless you are teaching in private schools. Having teachers from different parts of the world will not only help the children get education and will also help them learn more about different parts of the world.
Hi, my name is Brisa Jazzo, and the title of my project is Education for the Underrepresented. California is home to more than 2 million undocumented immigrants, which is about 2/4 of the population. Even though we're a minority majority, there is fear and unfair treatment everywhere because of the Trump administration. Parents trust in the schools to educate their kids for a chance at a better education. But more often than not, they have to work twice as hard for education than documented students. A study that Texas conducted on current immigration service utilization showed barriers like undocumented immigrant stressors, limited resources, and fear of resource utilization. In Southeast Michigan, their data shows why there's a delay in service utilization, which is deportation threats, the unreliability of authority figures, low income, and schools. And yeah, my target population is 13 through 18-year-olds because they're the ones that tend to struggle the most in schools, especially if there aren't many resources available. My proposed solution is to create a policy change the community has represented. The policy will specifically be about equitable distribution of education for undocumented Latino immigrants. If this is successful, some future steps are going to be program collaboration with Juntos, and my own title will be Ulira, which is Undocumented Latino Immigrants Rising Above Adversity. It will be stationed in middle and high schools to support them with services like post-secondary options, implementation of support groups, mentors experienced with immigration obstacles. Institutions will be improved by this because more often than not, undocumented Latino immigrants tend to feel discouraged by the extra work they have to do because of their legal status. This way, they have a support group. The ideal positive outcome that will be achieved from this is to have the 1 to 5% of undocumented immigrants attending college to be up to 45%. This will improve their lifestyle because they'll have more representation. Education is not a privilege, but a right for everyone. Thank you for your time.
Hi, my name is Jennifer Pham, and my project is on providing teens that are low income in the West Contra Costa Unified School District's mental health resources. And according to the WCCUSD School-Based Health Center Evaluation Report and Data Dashboard, there were over 7,000 high school students in the 2016-2017 school year, and about 62% of the students identified as low income. And according to a 2012 article written by the American Psychological Association, poverty is cited as the context of stress, and economic hardship is one of the most pivotal chronic stressors that can lead to mental health issues. And so my target population is being affected unfairly because outside of school, they either do not have resources and or time to get the mental health help they need. And so these kids are stressed because of two main reasons: academic pressure and familial pressure. An example of academic pressure is studying for multiple different classes at once and trying to pass them. And so an example of familial pressure is having to work to provide for their family. And so my target population are teens who attend WCCUSD high schools, and they are specifically low-income teens, as these teens who identify as low income are more likely to be stressed than their wealthier counterparts. And so my solution is to introduce more school psychologists in all WCCUSD high schools, and to have school psychologists conduct group therapy sessions in all English classes once a month, and to have an option of individual therapy as well. And to keep these students satisfied, a survey will be taken at the end of each session to provide feedback on to see what the students need or want. And so if my solution is successful, low-income students will have an outlet for their problems and they will have less stress. Thank you.